So if you've landed on this video, you're probably interested in lung cancer information, or you're also thinking about lung cancer recurrence. So I'm speaking to you from just knowledge that I've gained as a patient and an advocate for the past 2 years. I was diagnosed with stage 3A lung cancer at age 28 on December 6, 2021, after a 3-month delay in diagnosis. And I think that when you're going through lung cancer and you're going down that Google rabbit hole, you can't escape the question of what are you gonna do, or like, what am I gonna do? How's my family gonna live if this cancer comes back? That's like the worst that could happen, right? And sometimes it's hard to ask your doctors that. I know that when they were putting me on targeted therapy, I asked, how do I know that the cancer is not gonna come back? And they explained in a very scientific way how my targeted therapy is kind of like a cancer police. But now, being in the lung cancer world, I'm meeting more and more people with reoccurrence. And just like thinking about it, the most important message that I can relay to you is actually a lung cancer patient advocate told me last year, like, if reoccurrence does come back, that you'll be more prepared, right, emotionally, and because you'll be able to ask questions, you'll be able to know how to navigate the healthcare system better. It's not going to be just like the first time when you were just finding out about what was wrong with your body. The second time around, you're already a different person. And then the other thing is that research, hopefully by that time, is going to be different. Right now, we're living in a world in lung cancer where science is rapidly, transforming, and it's getting better and better each day. But if you think about it, let's say the recurrence happens a few years later or a few months later, you'll be able to navigate that way better than you did the first time. And when she had told me that, I think it helped heal my anxiety towards reoccurrence, because you never know what's gonna happen, right? Cancer was already in my body once, it might come back, who knows, right? This is something I'm not able to talk about with my family because I don't want to hurt them. Like, my diagnosis already hurt them so much, but I know that anxiety of thinking, even practically, right, about lung cancer reoccurrence is trust. If you're faithful, trust in your faith. And if you're more of a logical person who trusts in research, like, please do trust in research. And the other advice that the same friend told me is that the time to live is now. Make time in your calendar to live, because if you are kind of monitoring your nervous system and finding more joy in everyday life and hope, then that's really the best that you can do, right? Make the best out of the time that you have now. But also, yes, there's questions to like your anxiety out there. So I hope that this message gives you some hope in regards to like anxiety about reoccurrence. And also, feel free to talk to your healthcare providers about it. Thank you so much.